Some risk factors for type 2 diabetes, such as a family history of the condition, age, and race, may be out of a person's control, but people do have control over other risk factors, including diet. I'm Erin White with your latest health news. A recent study found that people who improved their diet had a lower risk of type 2 diabetes than people who made no changes to their diet. The researchers discovered that a better diet reduced the risk of diabetes regardless of other diabetes risk factors. Eat a healthy diet to lower your diabetes risk.
More women are choosing an aggressive treatment option for a diagnosis of breast cancer, and this trend is rising fastest in a certain group of women. I'm Shelby Cullinan with your latest health news. To track trends in treatment of early-stage breast cancer, a research team reviewed a large database of information to find which type of surgery women chose as their treatment. The results show that when cancer was found in one breast, more young women than in previous years were choosing to have both breasts removed. The authors of the study wrote that the chance of getting cancer in the other breast was only 3% in 5 years and 6% in 10 years. They also explained that these rates have been dropping due to the development of more effective treatments. Ask your oncologist about breast cancer treatment options.
If you're a parent, you've undoubtedly had some questions about childhood vaccines. Namely, are they safe? I'm Rochelle Grossman with your latest health news. The latest medical review funded by the U.S. Department of Health and Human Services found that immunizations for children overwhelmingly offer more benefits than risks. Researchers found a few serious side effects, including seizures resulting from high fevers after the MMR vaccine and a bowel condition associated with the rotavirus vaccine. They say if you have questions, you should discuss vaccinations and their safety with your child's pediatrician.
Multiple sclerosis, also known as MS, is a disease that affects the nervous system, especially parts of the brain and spinal cord. Nerve cells in these parts of the body begin to lose their protective myelin sheaths and become damaged. This causes many different negative effects on a patient's health. Early symptoms of MS include eye pain, difficulty seeing, muscle weakness, balance problems, prickling in the faces, arms, and legs, and urinary issues. Caucasian patients, women, and patients between the ages of 25 and 40 appear to be at a particularly high risk for MS. The cause of MS remains unknown and there is no cure. Certain medications are effective at slowing down the progression of MS in some patients. These include many newer drugs including fingolimod, natalizumab, and terflunomide. Physical and occupational therapy may also help patients manage MS symptoms over time. Some patients will eventually need help walking or performing daily activities. Early detection can help with the management of MS. Your physician may need to perform tests, including imaging scans, to diagnose MS.
You expect food to nourish you, not to make you ill, but foodborne illness remains a problem in the U.S., as a new study has shown. I'm Shelby Cullinan with your latest health news. This new study from the CDC looked at preliminary data for 2013 to examine trends in these illnesses during the last year. Salmonella infections, the most common type of foodborne illness, is often transmitted through foods with an animal origin, like meat, milk, or eggs, but any food can become contaminated with bacteria. Whereas Vibrio bacteria are usually transmitted through raw or uncooked seafood. The study found that rates of foodborne illness in the U.S. largely stayed stable in 2013. But while salmonella infections decreased, illnesses caused by the bacteria Vibrio saw a big jump. Make sure your food is cooked and cleaned thoroughly before eating.
Prescription medications are familiar to many people in the United States, but just how common are they and which types of medication are we mainly using? I'm Sonia Singh with your latest health news. A new report by the Centers of Disease Control and Prevention, or CDC, analyzed the use of prescription meds in the U.S. The report showed that during 2007 to 2010, almost half of Americans had used a prescription medication in the past month, and many of these Americans were using said medications for heart-related issues and cholesterol levels. Speak with your doctor to learn more about the appropriate use of prescription medications.
Previously, researchers found sitting for long periods of time increased the risk of chronic disease and death. Now, a new study shows that it also increases a person's risk for cancer. I'm Miranda Savioli with your latest health news. German researchers recently found excess sitting brings on a higher risk of colon, endometrial, and lung cancer. Sitting in front of a television further increased these risks because it is usually accompanied with junk food and sugary drinks. These risks were separate from physical activity, so extended periods of sitting still possibly affected the health of physically active participants. Tell your doctor how much time you spend sitting down.
Vaccines are designed to protect against disease, but babies cannot get most vaccines until they're 2 months old, leaving them vulnerable. A vaccine during pregnancy may help. I'm Shelby Cullinan with your latest health news. A recent study found that giving mothers a vaccine against whooping cough during pregnancy increased their baby's protection against the disease after birth. The vaccine is called Tdap, which stands for tetanus, diphtheria, and acellular pertussis. The newborns whose mothers received the Tdap during pregnancy had more antibodies against whooping cough than the babies of mothers who received the Tdap after giving birth. Ask your OBGYN about the Tdap vaccine during pregnancy.
Summertime brings sunshine and warmth, but also mosquitoes and attempts to ward them off. Many people might wonder whether insect repellents with DEET are safe. I'm Erin White with your latest health news. DEET stands for N,N-diethylmetatoluamide, a compound shown to be effective in warding off insects. A recent study found no evidence of negative health side effects related to the use of DEET at the recommended levels. Take steps this season to prevent mosquito bites.
Poor diet can contribute to the risk of developing type 2 diabetes, but which is the right diet to reduce that risk? I'm Shelby Cullinan with your latest health news. People with type 2 diabetes have high blood sugar because their bodies do not use insulin effectively to reduce the blood sugar levels. Results of a recent study have shown that several healthy diets, including the DASH and Mediterranean diets, can reduce the risk of developing type 2 diabetes. These diets emphasize vegetables, fruits, whole grains, beans, seeds, nuts, and healthy fats, as well as certain types of lean meats, fish, and low-fat dairy products. Ask your doctor how to cut your diabetes risk.
About 1.5 million people around the world are currently on hemodialysis, an artificial blood filtering treatment for kidney failure. This treatment is known to impact patients' physical function, but they may have more control than they realize. I'm Erin White with your latest health news. A recent study found that hemodialysis patients with more muscle mass had better physical function compared to hemodialysis patients with low muscle mass. The researchers suggested that physical activity that builds muscle mass may be associated associated with better overall health and quality of life for hemodialysis patients. Discuss an appropriate physical activity regimen with your doctor.
For many, using aspirin can be a huge help when it comes to fending off a headache and reducing the risk of a heart attack. However, could aspirin also help lower the risk of a certain type of cancer? I'm Sonia Singh with your latest health news. A new study funded in part by the National Cancer Institute has found that people who carry a particular gene may reduce their risk of colorectal cancer by taking aspirin. The study focused on over 200 colon cancer cases that developed over the course of 3 decades. Although research is ongoing, researchers concluded that doctors could safely take a biopsy from the colon during a colonoscopy to determine which individuals would benefit from a daily low-dose aspirin regimen. Speak with your doctor to learn more about the benefits of aspirin.
COPD, otherwise known as chronic obstructive pulmonary disease, is a condition where the airways to the lungs are blocked from performing as well as they should. COPD may only cause mild symptoms at first. COPD symptoms include a cough that produces a lot of mucus, shortness of breath, especially with physical activity, wheezing, and chest tightness. Without proper management, COPD symptoms can become more severe and can even become life-threatening. A large portion of patients with COPD are active or former smokers. Long-term exposure to other lung irritants such as air pollution, chemical fumes, or dust may also cause or worsen COPD. There is no cure, but many treatments may help relieve symptoms. Bronchodilators, inhaled and oral steroids, and tiotropium are safe and effective medications often used. Oxygen therapy, surgery, or even lung transplants are sometimes necessary for certain patients. Patients with COPD or those trying to prevent COPD should avoid smoking or working in settings with poor air quality. A healthy diet, proper exercise, and other healthy lifestyle choices can also help prevent or manage COPD in many patients.
Untreated appendicitis can have serious consequences, but surgery may not be the only option for children with the condition. I'm Erin White with your latest health news. Appendicitis occurs when the appendix becomes inflamed or infected, swollen, and painful. Researchers found that appendicitis was successfully treated with antibiotics in almost all of the children who were treated with them. This treatment meant kids could return to school sooner and felt better than the children whose appendicitis was treated with surgery. Speak with a doctor about the risks and benefits of different treatment options.
Many people drink caffeinated drinks like coffee or tea on a daily basis. It's possible that even small changes in coffee consumption could affect their health in a major way. I'm Shelby Cullinan with your latest health news. A recent study found that people who increased their coffee consumption by more than 1 cup per day over a 4-year period were 11% less likely to develop type 2 diabetes in the following 4-year period compared to people who did not change their average coffee consumption. The findings reveal that these increases and decreases in type 2 diabetes risk were only associated with caffeinated coffee. Discuss your daily coffee consumption with a doctor.
To get the best and trusted health and medication information, join us at rxwiki.com. Sign up for the rxwiki.com newsletter by going to rxwiki.com and clicking subscribe on the right side of the RxWiki homepage to receive the latest health news and videos delivered in a consistent and easy-to-understand language. rxwiki.com, for patients by pharmacists.
For those with chronic high blood pressure, keeping healthy is essential. Exercising and maintaining a healthy diet can delay or prevent diabetes. These interventions can even save lives. I'm Sonia Singh with your latest health news. Prediabetes is constantly high blood sugar that isn't quite high enough to qualify as diabetes. A study was conducted with patients who have this condition, some of which were assigned to a diet or exercise intervention, while others received standard medical treatment. Following up 20 years later, the intervention group had significantly lower rates of death from all causes and from heart disease, as well as lower rates of diabetes. Speak to your doctor about diabetes prevention and treatment.
An arrhythmia is a problem with the rate or rhythm of the heartbeat. For a variety of reasons, the heart can sometimes beat too quickly or too slowly. In other cases, the heart can beat with an irregular pattern. The most common type of arrhythmia is an atrial fibrillation, which is a rapid, irregular beating of one of the upper chambers of the heart. Symptoms of arrhythmias include lightheadedness or dizziness, chest pain, shortness of breath, and sweating. Arrhythmias can sometimes cause or indicate more serious heart problems in the future and should be examined carefully by a cardiologist. Many factors can affect the heart's rhythm and produce arrhythmias. A previous heart attack, a history of smoking, congenital heart defects, stress, and injury can all produce problems with the way the heart beats. Some illegal drugs and even medications may also cause arrhythmias. Treatment for arrhythmias generally attempt to prevent arrhythmias or decrease the severity of arrhythmia symptoms. Medications including amiodarone, certain calcium channel blockers, and digoxin have been used to effectively treat arrhythmias. Some patients may need an implantable cardioverter defibrillator, ICD, a pacemaker, or even surgery to address serious problems with the heartbeat. Maintaining your heart's health is an effective way for patients with arrhythmias to avoid complications. Eating a balanced diet, exercising, and reducing alcohol use, smoking, and stress can all provide benefits that can minimize arrhythmias and the risks they pose.
Electronic cigarettes, or e-cigs, are often marketed as a healthy alternative to regular cigarettes. But are they? I'm Rochelle Grossman with your latest health news. New research is questioning whether people are really aware of the effects e-cigarettes have on their health. In fact, a new study discovered that many people didn't even know if e-cigs were harmful. The study found that those most likely to have tried an electronic cigarette were current smokers, people between the ages of 15 and 24, and those who had previously attempted to quit smoking. The researchers concluded that e-cigarette users should discuss the potential risks of smoking e-cigs with their doctor.
While it's true that childhood obesity is a complex problem influenced by many factors, the key to combating this problem may lie in 3 simple rules of thumb. I'm Erin White with your latest health news. A recently published paper cited the 3 rules as eating a mostly plant-based food diet, being more active, and turning off media. It concluded that by replacing noise, processed foods, and physical inactivity with silence, minimally processed foods, and physical activity, parents and children can lead healthier lives. Make sure to eat healthy, get moving, and limit your family's media intake.
A woman experiences a variety of changes to her body while she's pregnant. While these are normal changes, they might influence her alertness or the way she's feeling occasionally. I'm Shelby Cullinan with your latest health news. If any person is feeling tired, nauseated, or otherwise not well, it may increase their risk of an accident while driving. A recent study found that pregnant women who may feel fatigue or nausea more often than usual had a higher risk of a car accident while driving in their 2nd trimester compared to their risk while not pregnant. Be alert and follow traffic laws while driving.
Taking prenatal vitamins is important for pregnant and breastfeeding women, but even these supplements may not give women enough of one crucial substance. I'm Kendra Rowland with your latest health news. A recent statement reviewed the importance of adequate iodine intake for pregnant and breastfeeding mothers. Many women do not get enough iodine, which can be found in yogurt, milk, iodized salt, shrimp, lobster, and other foods. Doctors recommend that pregnant and breastfeeding women take daily supplements of at least 150 micrograms of iodide. Ask your OBGYN about taking iodine supplements.
Here's another reason to make whole grains and vegetables a part of your diet. Getting enough dietary fiber may be a life-changing health decision for people who've had a heart attack. I'm Erin White with your latest health news. Fiber is commonly found in vegetables, fruits, beans, legumes, and whole grains. Recent research looked at the link between dietary fiber consumption and death in people who had previously had a heart attack. The researchers found that participants who ate the most fiber had better survival odds than those who ate the least. They noted that dietary fiber from cereals provided the strongest protection against death. Get your daily recommended amount of dietary fiber. One of the scariest moments for a parent can be seeing their child hit in the head, especially if that hit is hard. If they sustain a concussion, it's important to know some guidelines for recovery. I'm Mindy Cook with your latest health news. Guidelines were recently published to help doctors in diagnosing and treating concussion injuries in children, but the information is valuable to parents as well. Red flags to note following a concussion involve neck pain, confusion, irritability, repeated vomiting, severe or increasing headaches, and unusual behavior changes. The published guidance suggests taking your child to the hospital if you notice these symptoms. A doctor should give advice on how to manage sleep, fatigue, and social interactions. Rest your mind and body while recovering from a concussion. Consuming lots of sugary drinks can expand your waistline, but you may not be aware of what it also might do to your blood pressure. I'm Erin White with your latest health news. Sugar is added to many food products, but the largest source of added sugar we consume is in sugar-sweetened drinks. Drinking sugar-sweetened beverages has been linked to obesity, high blood sugar, heart disease, and kidney stones. Recently published research found it was also associated with increased blood pressure and a greater risk for developing hypertension. The studies that researchers analyzed showed a 26 to 70% increased risk of developing high blood pressure in people who consumed sugar-sweetened beverages compared to people who did not drink sugar-sweetened beverages. Speak with a doctor about healthy blood pressure levels and limit your consumption of sugar-sweetened beverages.
Hypertension, or otherwise known as high blood pressure, is a condition identified by blood pressure that rises and stays higher than what is normal. High blood pressure often has no immediate noticeable signs or symptoms, but very high blood pressure can cause headaches, vision problems, and even damage certain organs. Hypertension that lasts for a long time can cause kidney damage, heart damage, and increase the risk of a stroke. Obese patients, older patients, smokers, diabetics, and patients with poor diets or a family history of high blood pressure are at a high risk of having high blood pressure. Alcohol abuse and illegal drug use can also cause blood pressure to rise. High blood pressure can be treated through healthy lifestyle changes such as diet and exercise, but in many cases, medications can help safely and effectively adjust blood pressure back to normal levels. ACE inhibitors such as lisinopril and diuretics such as hydrochlorothiazide are commonly used to treat high blood pressure. A wide variety of blood pressure medications are useful in different situations to treat hypertension when other medications fail. Preventing and managing hypertension is important to living a healthy life. Maintain an active lifestyle with plenty of exercise and avoid excessive salt intake in your diet. If you have a family history of hypertension or other major risk factors, take the time to monitor your blood pressure periodically.
Drinking alcohol or smoking has been shown to increase the risk for esophageal cancer, and enjoying the two vices together might raise that cancer risk even further. I'm Shelby Cullinan with your latest health news. Esophageal cancer is cancer of the tube that carries food and drink to the stomach. While the combined effect of drinking alcohol and smoking increased the chance of developing esophageal cancer, researchers reported that when the two habits were taken together, the cancer risk was greater than having either habit on its own. The researchers recommended that the intake of alcohol and the use of tobacco be reduced as much as possible. Tell your doctor if you drink alcohol or smoke.
COPD causes difficult breathing, which can lead to anxiety and insomnia. A new study says a common type of medication used to ease these symptoms may not be the best option for those with COPD. I'm Erin White with your latest health news. This new study showed a significant increase in the risk of COPD patients having a severe respiratory event, such as shortness of breath or fits of coughing, when prescribed a benzodiazepine medication. Study data showed that COPD patients who used benzodiazepines were 45% more likely to experience respiratory-related side effects than the group not taking benzodiazepines, as well as 92% more likely than the benzodiazepine-free group to require emergency room treatment caused by increased severity of their COPD symptoms or the development of pneumonia. Speak with a doctor about your COPD symptoms and medication that is safe and effective for your condition.
Asthma is a chronic airway disease that can negatively affect a patient's breathing. During an asthma attack, the inside walls of the airways become inflamed and swollen. This causes the airways to become narrower and decreases the amount of air that can come in and out of the lungs. Symptoms of asthma include wheezing, coughing, especially early in the morning or at night, chest tightness, and shortness of breath. Not all people who have asthma have all of these symptoms. These symptoms alone don't always indicate a case of asthma. Allergens such as pollen and animal dander, and air pollutants and irritants such as cigarette smoke can trigger asthma. Cold weather and exercise are also common triggers. Severe asthma attacks may require emergency care. Asthma is commonly treated with two kinds of medications: quick relief rescue medications such as albuterol to stop asthma symptoms, and long-term treatments like inhaled corticosteroids and leukotriene antagonists to provide sustained relief. Asthma patients should be very aware of their asthma triggers and keep a rescue inhaler nearby at all times. Asthma in children can be especially dangerous, so parents should learn the signs of an asthma attack and what to do. Make sure if you have asthma to take your medications regularly and to have a plan whenever you may have an asthma attack.
The risks of smoking can extend beyond your own health and that of the individuals breathing the secondhand smoke. They may extend to your children's choices as well. I'm Shelby Cullinan with your latest health news. A recent study found that teens were increasingly more likely to smoke with each extra year their parents smoked since the kids were born. Even if the teens were not regular smokers, they were more likely to experiment early on with smoking for each additional year their parents lit up. Quit smoking before having kids.
If you have allergies, you know your symptoms can change during the day. And based on new research, there might be a pattern to when your pollen allergies are at their worst. I'm Rochelle Grossman with your latest health news. A team in Denmark found there may be specific times when allergy sufferers should stay indoors, and those times change. The research found the early season displayed two peaks, in the morning and evening. The mid-season pollen count spiked once in the evening, and the late-season peak came in the late morning into early afternoon. Keep up with your local pollen count forecast to work with the change in peak hours and talk to your doctor about managing seasonal allergies.
E-cigarettes have become a popular fad among smokers and have often been used as a substitute for regular cigarettes. Yet the debate surrounding them has grown, and now rules governing the products may become stricter. I'm Kendra Rowland with your latest health news. The FDA has proposed that e-cigarettes and other tobacco products would fall under their regulation. The FDA currently regulates certain tobacco products, including cigarettes, roll-your-own tobacco, and smokeless tobacco, but not others. The proposed change would extend this regulatory authority to include additional products. The rules would require e-cigarettes to include health warnings and only make health claims confirmed by the FDA. Speak with your doctor about healthy ways to quit smoking.
Celiac disease is not common among children, but it may have been underdiagnosed until recent years. Knowing risk factors for it may help parents. I'm Shelby Cullinan with your latest health news. A recent study was conducted of nearly 1,000 children in Italy who were assessed for stomach problems. The children were classified as having either irritable bowel syndrome, abdominal pain, or upset stomach indigestion. The study found that children with irritable bowel syndrome are 4 times more likely to have celiac disease than children without irritable bowel syndrome. These findings mean that parents of children with irritable bowel syndrome may want to ask about screening for celiac disease. Ask your pediatrician about celiac disease screening.